Thank you very much. I appreciate it. Now, what John didn't disclose is that I was born and raised in St. Louis. So this has been a hard couple of weeks. But
I hope you catch you.
Yeah, I hope you won't hold that against me. But at any rate, I think we're now, in terms of history, maybe even in the series of World Series series over the past 100 years. So we'll be back at it, I'm sure, another year. But it's really a pleasure to be here, and it's a pleasure to follow the commissioner who has really outlined what a success story is that's been built over time. And what I'd like to do is kind of back up from that and look at a national perspective. And also end with talking about what are some very promising signs of progress. But before we go there, I want to talk about the problem in a little bit of detail. Now, just one anecdote. As John mentioned, I am a pediatric nurse practitioner, and I started out working in the Head Start program with low-income children. And this was about roughly 35 years ago. And still today, as it was then, when children came into Head Start, we measured their height and weight, and we did a number of other screenings. And then we measured it again at the end of the year. So we had some good data in terms of what was happening with those children. And what we noticed, what I recall from that time, is that maybe somewhere in a classroom of roughly 40 children, we would have 2 to 4 children that had some kind of nutritional problem. Now, the vast majority of those 2 or 4 children were not overweight. They were underweight. So we would have relatively small numbers of preschool children that were overweight. And I don't believe that in the years that I was doing this, that I really saw true obese children that were 4 to 5 years old. Some friends of mine that are nurse practitioners and still active clinically tell me that now when they do preschool evaluations on children, that routinely, they see, if they do 20 children, they'll see somewhere between 6, 8, 10 of those children overweight or obese. So this has been just an incredible change over the course of the past 30 years. We have data that kind of look at this, and this is, I'm going to go back and forth a little bit between adult obesity and childhood obesity. Some of the more historical data we have actually is measures of adults. So what I want to do is kind of take you back quickly, looking at national data about adult obesity, starting out. We can get this to move along. There we go. Starting out in 1985. And what you'll notice is, as we begin, that the states for which we have data, the darker shade of blue, 10 to 14% of adults are obese. And as we start moving through the years here, you'll see the colors spreading and getting darker. More and more states have higher rates. We're still, again, 10 to 14% by the late 1980s. And by 1990, you could really say that the vast majority of the country. And now we have a new color, darker blue, that's 15 to 19%, so up to 1 out of 5 adults. Again, this is obese, so 30 pounds overweight or more. And we see this kind of continuing pattern spreading across the country. And now by the late 90s, we actually have another color entering the picture where greater than 20% of the population is obese. And it continues, and then by 2000s, we see that we have now 25% of adults that are obese in some states, and that's growing. And it continues, and that by just halfway through the first decade, we now have states that have greater than a third, roughly, of their adults that are obese. So that when we started this out, excuse me just for a second, we had a number of states that were 10% or less. Now the best state has more than 20% or 20% or above adults are obese. And then, as Commissioner said, when you add the overweight to the obesity, that for our adult population, it's roughly 2/3, at least 2/3 in almost every state is overweight or obese. So this is reflected in our child population as well. Again, this is childhood obesity, so it doesn't include overweight numbers here. And you can see that the same kind of epidemic was occurring among our children. And as we see the green line there, which is the younger children, starting to tail downward, and I'll be talking more about that later in the presentation. Now, in these slides, and forgive me for this one being a little bit out of focus, but in the 2000s, we've started to get some data on the county level for childhood obesity. And this is really looking at low-income children, so children that are primarily receiving supplemental assistance through the WIC program, a nutritional program for pregnant mothers and children under 5. And again, dark blue is around 20% of these children are obese. And here we have a little bit more detail, but again, it's looking at it on a county level, looking at the years of 2009 to 11, county prevalence among low-income children, so not all children, but perhaps our most vulnerable children. And you can see the darker areas mean higher rates of childhood obesity. So at the Robert Wood Johnson Foundation about 7 years ago, the leadership and the board looked at what was going on and decided that we needed to set a very bold goal of reversing this epidemic by 2015. And believe me, we're very aware that 2015 is getting closer and closer. So at that time, the foundation committed $500 million, $500 million to this endeavor to reverse the epidemic by 2015. So I want to talk to you about the approaches that we've taken and the progress that we're beginning to see. But let me just tell you that our approach, much like the approach has been here in Massachusetts, is to really focus on changing the things that, yes, ultimately we have to get to change behaviors. But to get there, we really need to change the social environment, the policies, the physical environment, and industry practices before we can, change those factors that then influence our behaviors. So let me just kind of illustrate this by talking a little bit with some illustrations here about children at risk and kind of what we're seeing typically and then what we're envisioning in terms of this change. So I think still for most of our children right now, vast majority of children get some kind of ride to school, either in a school bus or through their parents' car. So 30, 35 years ago, 40 years ago, more than 50% of children walked or biked to school. Now that's about 15%. So that's how the day starts. The day continues in most of our schools without a lot of physical activity. Most of the time is spent in classrooms, as this young man is doing, head down, doing his classwork. Only 4% of our elementary schools across the country have daily physical education. Only 8% of our middle schools. So it's really not too many opportunities for what we agree is the recommendation that a child needs an hour of physical activity, strenuous physical activity, each and every day. And then still too often, the children will have a lunch that looks much more like this, with corn dogs and French fries, things that they're pretty likely to eat, but not exactly the healthful food. Then school ends, and most of the children will go home and spend screen time. So on average, children are spending 4.5 hours of screen time each and every day. Now again, part of this is determined by the social environment. Are there parks nearby? Are there schools or after-school programs that have recreational opportunities? Are the neighborhoods safe so that children don't have this recreation as really the only safe recreation alternative? Then again, many of our neighborhoods are like this neighborhood in Los Angeles, where what's easily available in terms of food choices for the parents to pick up for dinner is from one of these fast food restaurants, where food is affordable. So just through kind of looking at a day in the life, if you will, of a child at risk, we can see the barriers to good health. And at the same time, we can also see the opportunities for change. So what about instituting walking school buses, where parents are involved in walking with children to school? And again, getting the day off to a good start and the end of the day with some exercise. What about bringing physical activity, both physical education as well as other physical activity opportunities, into the school in significant amounts, using activity breaks, making sure that recess is active, and that, yes, there is physical education as part of every day. Changing nutritional standards for schools and making sure that we see school lunches that look more like this than the corn dogs. And then really finding opportunities for more physical activity, safe physical activity, parks, after-school programs, making healthy foods more accessible in our neighborhoods, in every neighborhood, so that at the end of the day, our children can have dinners that look more like this, these kinds of food choices, that they're affordable to parents, and that rounds out the experience of the child during the day. So as we've been working on childhood obesity at the foundation and with our partners across the country, we've really focused on these 6 policy priorities. So really looking at ensuring that school foods meet dietary guidelines, promoting access to healthy food in all of our neighborhoods, again, promoting physical activity in school and out of school, increasing the physical activities through the built environment, through making changes to the built environment, using pricing strategies to really promote the purchase of healthier foods, and importantly, trying to reduce youth's exposure to marketing. So let's just look at a couple of things that kind of indicate some changes that have happened and some progress that we're making. Back when we started this in 2008, a poll was done with policymakers across the country that showed that overwhelmingly, almost 2/3 of policymakers believed that obesity was really the result only of individual behaviors. Over time, we've been able to start shifting that to the understanding that there's both the influence of the external environment and individual behavior choices that kind of lead to what we're doing. Childhood obesity, quite frankly, is becoming a little bit hotter. We've got J-Lo. We've got all kinds of sports folks involved, and I think importantly, since First Lady Michelle Obama has been involved with really making this the focus of her activities, it's really increased the visibility of this and really kind of changed awareness across the country. We have seen, and this is really one of our major investments as a foundation, we have a national program that's a Healthy Schools program that's supported by and really run by the American Heart Association. We now have over 19,000 schools involved in that. That again is probably translating into about 2 million or so students. And we're seeing some real progress in those schools in terms of policy changes, really changes to the entire environments of the schools, both in terms of nutrition and in terms of physical activity. Just an illustration of this, again, kind of looking at what was happening in terms of policy in schools in 2005. Less than 5 states in 2005 had strong school nutrition rules. Likewise, had requirements around fitness screening. That's changed now in 2010, and it's continuing to change, so that the trend is definitely increasing in terms of schools, systems on a state level that have these basic policy building blocks. There's been a tremendous growth in research across the country that we're proud to be a part of, but we have many, many partners that are doing this, particularly from our government, but also with other members of the philanthropic community, and we're really seeing that much more evidence is being built about what exactly works in terms of prevention and reversing obesity in children and in adults. Some of the research that we have supported has been particularly focused on policy areas, and so the Rudd Center is one example of really focused policy research that is impartial and based on gathering the evidence and building the evidence for understanding what industry, what others can do, what's the impact around media. And what we're seeing is that increasingly corporations are understanding that if they don't grapple with these issues, there's a risk to their brand and ultimately to their ability to have sales. So we see that that's a major change. We've also seen that, again, school policies have been changing. Again, part of this with the national policy framework that really makes it possible for school leaders to take a stand on this with the evidence behind them. Part of what we've been doing as well is trying to do much more to build consumer involvement. So we have this online community that's called preventobesity.net, which I'd encourage all of you that are interested in this to go home and sign up on this. You can get information. You can get alerts about this. And what it does is help harness citizen involvement to influence policy. So again, working on these new school meal standards is really incredibly influenced by public comment on these proposed rules. And I think that's very, very important. When you look at things like right now with the attempt to pass the food stamps legislation. It really is, it's a tough fight, and we need to have citizen involvement in creating demand for the right policies. So we're seeing continued momentum in this area. One of the other areas that I haven't mentioned, but likewise was really influenced, was the transportation bill, the reauthorization of the federal transportation laws did, in fact, incorporate the complete streets and the safe routes to school funding that the commissioner was talking about. So again, very important policy that starts at the federal level and then has an impact on state and local communities. We've also seen through this research and through the influence of more and more people getting concerned about this, that industry is starting to make changes too. So the Hudson Institute, which really is a business-oriented, right-of-center political institute, did do a focused study on return on investment and made the business case. And it's really had some influence in terms of business practices. So we've seen a few corporations. Darden is the company that owns Olive Garden restaurants. And so they've changed their menus, particularly their child menus. Hyatt, of course, is a hotel chain. Bright Horizons is a major child daycare provider across the country. And they've made policy changes that have increased physical activity for all the children in daycare in their centers, as well as having nutritional standards. We've seen this with Walmart coming out, and it's launched its own healthy brand of foods. And they've made a commitment to open 300 stores in areas, in communities that have that are essentially food deserts across the country. Opening 300 stores, making nutritional foods available in those neighborhoods by 2016. And then very recently, McDonald's has even gotten into the swing. Part of this was, I think, driven by some changes that happened with Disney, because the Disney Channel said they were no longer going to take quote-unquote junk food ads as sponsors. And so McDonald's, I think, was working on some of these changes and decided to come along and institute them very recently. And they're marketing only water, milk, and juice as beverages on their Happy Meal. And they're really trying to utilize Happy Meals to generate excitement around healthier options. And so their advertising is being directed in this way. They also have announced that as part of what they're doing, they're going to retain kind of an independent third party to verify what they're doing. As President Reagan said, trust but verify. So it's a fair amount of motion now in the industry, in a variety of industries that are really starting to change some of the practices that probably had a lot to do with creating obesity in our country. So some of these are just kind of a sprinkling of indicators that we measure internally in terms of really looking at some of the initiatives that we have. So again, the Healthy School Program, wanting to see schools rapidly sign up with us, but then also move in adopting these aggressive policies around improving nutrition and physical activity. Looking for states that are developing healthy food financing initiatives, again, to make healthy food available in high-risk communities. And really seeing, again, in schools, a reduction of competitive foods, reducing their availability in schools. So SSBs, or sugar-sweetened beverages. And you can see across the line there that there's been some significant progress. Again, these are in schools that have identified with the Healthy Schools program, but there's 20,000 of them now. So these are starting to be big numbers in terms of starting to remove some of these foods that are not healthy for our children. So what have been the results? I mean, the thing that maybe seems frustrating is that it's such a huge problem. And are we starting to see any change at all after 7, 8, 9, 10 years of a lot of awareness and action? And we are. This is some initial data that we have on a couple of states, very different places, California and Mississippi. And when you think about the numbers, we're going to be seeing these numbers in terms of percentages. But if you take the California number, for example, which is a 1.1% decrease, okay, keep in mind that these numbers have been going up, and now they're either flattening or coming down. So in California, what that translates to is about 14,400 children, okay, in healthy weight categories now. So that's significant when you start translating it from percentages to actual children. We've seen very dramatic declines in places like New York City. And at the same time, one of the things that we want to emphasize is that while these are very dramatic, particularly in New York, the benefit is still not as evenly spread, particularly when we see that lower income kids and children of color are disproportionately affected by childhood obesity, and yet the reductions are not happening quite as fast. So we need to keep that in mind as we move forward. Another sign of progress, this is a report that the Trust for America's Health has been putting out every year for 9 years. So in their summary report, these are startling facts, I guess, to keep in mind. That the average adult today weighs 24 pounds more than the adults did in the 1960s. That the worst state obesity rate 30 years ago, the worst state, was lower than the best state today. Okay, so the worst state 30 years ago is lower than the best state. And in 2005, 49 states had significant increases in obesity. So that was really a very kind of marked increase. Now what we're seeing though is starting with that baseline 9 years ago, that there actually has been some progress. So again, these are states with significant increases in adult obesity, and what we're seeing is that is going down until 2013. There was only one state that had a significant increase. So we're very hopeful that all this hard work, all of the research, the adoption of these practices, changing policies, starting to see these signs of hope that maybe this curve has plateaued and that the epidemic, in fact, might be reversed by 2015. So just the caution there is that none have had significant decreases yet, none on a statewide level in terms of adult obesity. Back to childhood obesity and the trends there. So there was a report that was issued by CDC, this actually in August, and it does report a number of places where we are seeing significant changes in childhood obesity rates. One of them actually being in eastern Massachusetts, where we saw a 21% reduction in the rate of childhood obesity. Now again, keep in mind that those rates were already very high. But again, the numbers underneath the rates represent real children in real children's life. So I think the message basically is that these things are starting to work and that we're seeing progress. We're very hopeful. And at the same time, we are far, far from the finish line. Not only in terms of absolute numbers, so if we have just using the example of Massachusetts, 21%, so if we had basically 30% of our preschool children coming into school obese and overweight, a 21% decrease means that now there's 24% are coming in. That's still a crazy number to have. It's just not something that we can sustain, because ultimately what that all means is that our children, if we don't continue to take action and sustain this action and reverse the epidemic, our children and our grandchildren will be the first generation in the United States to have shorter and sicker lives than their parents' generation. So that's really what we're facing. So it's a message of hope, but it's also a message that we can't take these things for granted. We have to keep the momentum going. I think we really have to support the far-sighted and correct policies that your state health department are pursuing, and make sure that there's adequate resources to support those interventions in Massachusetts and across the country. So with that, thank you very much.